you for coming in today. I know this PKU diagnosis was unexpected and a bit of a shock. I'm here to support you and your family with everything that you need. How are you both feeling today?
Honestly, we're confused and worried. The pregnancy has had no complications and the baby looks completely healthy. How could she have PKU?
That reaction is completely normal. Babies born with PKU usually look perfectly healthy. However, PKU, or phenylketonuria, is a genetic metabolic disorder where the body cannot properly break down this amino acid called phenylalanine. This happens because of a mutation in the PAH gene which prevents the body from making an enzyme called phenylalanine hydroxylase.
What does that mean for her health?
Without treatment, phenylalanine can build up in the blood and brain. This can cause serious health problems as skin disorders like eczema, developmental issues as a child, and even a musty odor. And lastly, it also causes permanent intellectual disabilities. But the good news is PKU is manageable if treated very early with a special diet.
We feel so guilty, like we've passed this on to her.
Please don't blame yourselves. PKU is an autosomal recessive disorder, so you could not have known that you guys were carriers for the disease. It's not upon you to know. Have faith.
If we're both carriers, will all of our future children have PKU?
No, each pregnancy carries a 25% chance only of a child getting PKU, which means you have a 50 to 75% chance that your child will be healthy and normal. Don't blame yourself.
But why didn't our aminocyte testing show this?
Aminocyte testing does not pick up on enzyme level or phenylalanine levels in the blood. Instead, doctors mainly rely on the newborn heel prick test to find if the newborn child has PKU or any other blood-related disease.
What foods will she need to avoid?
Anything high in protein, like chicken, eggs, beef, or fish, cannot be eaten by the child, especially at a younger age when she's still developing fully. She'll be on a special phenylalanine diet and will have to be eating low-protein foods for the rest of her life.
Will this affect her long term?
If not treated, yes. But if your child is treated, she can live a normal and full healthy life and grow up to be a strong and independent individual. However, this does mean that she must go in for checkups every couple of months to make sure that her aminocyte levels are up to date. Here's what I recommend for you and your daughter. Begin feeding with PKU formula instead of immediately going to breastfeeding. Schedule regular clinic visits for growth and developmental monitoring. Consider genetic carrier testing for both you and your husband before considering getting pregnant again. For future pregnancies, consider getting pre-testing for like CVS or aminocytes so you can test for PKU early. Or, instead of having another child, adoption or donor gametes are also an option if you want to eliminate PKU as a risk completely.
Thank you. This makes much more sense now.
You're very welcome. I'm here to support you and your baby along the way in any way I can possibly can. Your baby's very lucky to have such protective parents like you.